Recorded Medication Teaching, an initiative of the Manitoba ACS Network and St. Boniface Hospital. Statins. Cholesterol is a type of fat that the body needs to stay healthy. Our bodies make cholesterol, and we also get some from the foods we eat. Over time, cholesterol in the blood may form plaque, a kind of fatty deposit in the walls of blood vessels. Plaque in the blood vessels can lead to reduced or blocked blood flow and can result in heart attacks. Statins are medications that lower the amount of cholesterol in your blood and slow down or stop the growth of plaque in the blood vessels. This lowers the risk of heart attacks over time. Statins need to be taken lifelong because the plaque-slowing effects of a statin can only work when the medication is in your body. The most effective statins are atorvastatin, also called Lipitor, and rosuvastatin, also called Crestor. Other statins include simvastatin, pravastatin, fluvastatin, and lovastatin. All statins are taken once daily with or without food. Atorvastatin and rosuvastatin may be taken at any time during the day, while other statins should be taken only in the evening. If you take atorvastatin, simvastatin, or lovastatin, you should avoid eating grapefruit or drinking grapefruit juice, or your risk of side effects will be increased. It's also best to limit your alcohol intake if you take a statin. Talk to your pharmacist or other healthcare provider to make sure your medications, including vitamins, over-the-counter medications, and herbal products, do not interact with your statin. Statins are usually very well tolerated. Most side effects are mild, but may include upset stomach, gas, or constipation. A rare side effect that some people may experience with statins is muscle discomfort that may feel like soreness, aching, cramping, or weakness. This usually affects large muscles in the legs, shoulders, or back on both sides of the body after taking a statin medication for some time. It's important to talk to your healthcare provider if you think you're having muscle discomfort because of your statin. Even in people who take statins, most muscle discomfort is not actually caused by the medication, but is rather a normal part of day-to-day life. It's common to be more aware of muscle discomfort after being warned to watch for it, so it's important for these symptoms to be carefully reviewed. Most people can continue taking a statin even if they develop muscle discomfort, although it sometimes may be a different statin than they started with, or maybe at a lower dose. However, if you take a statin and have very bad muscle pain or dark tea-colored urine, see your healthcare provider right away. The protective effects of statins are not something that you can feel, but these effects grow over time. By taking a statin every day, making healthy diet and lifestyle choices, and following up with your healthcare team, your risk of heart attacks can be greatly reduced. If you have any questions, talk to your pharmacist or other healthcare provider. Visit the Manitoba ACS Network website at www.mbacsnetwork.ca